Let me pose an uncomfortable question to you. If Dr. Bennett examined you right now and declared, based on your physiology, here is the most statistically probable manner in which your body will begin deteriorating after 60, would you want to hear it? The majority of people say yes, and then they spend the following decade disregarding the precise information that could have prevented it. Here is what Dr. Bennett finds extraordinary after years of practicing preventive medicine. There exists a single piece of data that every individual in this country has possessed since birth. It rests on a card tucked in a drawer somewhere or on a hospital document from 3 decades ago. And it is one of the most underutilized biological indicators we have for forecasting age-related disease patterns. It is your blood type. Not in the manner diet books exploit it, not in the way wellness influencers discuss it, but in the way peer-reviewed epidemiological research spanning hundreds of thousands of patients monitored over multiple decades has progressively demonstrated that your blood group leaves a measurable imprint on how your cardiovascular system ages, how your brain withstands pressure, how your immune system behaves when it is under assault, and yes, statistically speaking, what is most likely to bring you down if you do not intervene early. Today, Dr. Bennett walks you through every blood type, O, A, B, and AB. And for each one, Dr. Bennett will share something most physicians never mention during a routine checkup. Not because they are concealing secrets, but because there is simply insufficient time in a 15-minute appointment to connect these dots for you. Dr. Bennett will accomplish that right now. But remain with us through the conclusion of this video because there is a modifier that sits on top of every single blood type, something beyond the letter on your card that significantly alters your personal risk profile, and most people have never contemplated it once. But right now, before we proceed any further, do Dr. Bennett a quick favor. Drop a comment below and share your blood type. O, A, B, or AB. Dr. Bennett will be walking through each one in this video, and knowing yours is going to make what follows considerably more relevant to you. Type O. Let us begin with type O, and Dr. Bennett wants to frame this differently than you have probably encountered before. Type O is the predominant blood type on Earth. Roughly 45% of individuals carry it. And for most of human history, that was likely an enormous survival advantage. Type O blood appears to have originated in our earliest ancestral populations, shaped by environments that demanded physical endurance, a robust immune response to parasitic infection, and a digestive system capable of processing substantial quantities of animal protein under stress. Here is what that ancient blueprint manifests as inside a modern body after 60. On the cardiovascular side, type O individuals tend to carry lower circulating levels of von Willebrand factor, a protein involved in clotting. Reduced clotting activity translates into smoother blood flow, diminished platelet aggregation, and a statistically lower risk of the arterial blockages that trigger heart attacks and ischemic strokes. Multiple large-scale studies have confirmed that type O individuals carry a meaningfully lower risk of coronary artery disease compared to A, B, and AB combined. That is the encouraging news, and it is genuinely encouraging. But here is what nobody tells type O men and women over 50. That cardiovascular advantage can transform into a psychological trap. Dr. Bennett has witnessed this pattern more times than can be counted. A type O patient in their late 50s arrives. Blood pressure is fine. Cholesterol is manageable. No family history of heart disease. And because they feel structurally protected, they cease paying attention to the systems that are quietly deteriorating. They disregard fatigue. They dismiss digestive complaints. They push through joint pain. Because type O's most serious age-related vulnerabilities do not originate from the heart. They emerge from below it. The stomach lining of the type O individual expresses surface receptors that the bacterium Helicobacter pylori finds considerably easier to attach to than any other blood type. H. pylori is not dramatic. It does not announce itself with intense pain in most individuals. It infiltrates silently, colonizes the gastric mucosa, and over years and decades, it gradually deteriorates the protective lining of the stomach. Left undetected, this produces a slow escalation from chronic gastritis to peptic ulcers to, in a meaningful percentage of cases, gastric cancer. And gastric cancer detected late is one of the more challenging cancers to treat successfully. There is something further. Type O individuals demonstrate a measurably elevated risk for certain peptic ulcer complications requiring surgical intervention compared to other blood types. This is documented. It is not speculation. So, if you are type O and you are over 55 and you have never been examined for H. pylori, that is the single most critical conversation to have with your doctor this year. It is a straightforward stool antigen test or a breath test. It is inexpensive. And for type O individuals, it is not routine caution. It is targeted prevention grounded in your specific biology. Here is your type O protocol for longevity. Your gut is your primary vulnerability. Protect it actively and consistently. That means restricting long-term use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin unless medically necessary. These medications erode gastric lining in everyone. In type O individuals, they impact tissue that is already operating at elevated biological risk. Incorporate fermented foods into your regular eating pattern. Kefir, miso, kimchi, naturally fermented pickles. These are not fashionable extras. For type O, they are a practical instrument for maintaining a gastric environment that is more resistant to bacterial colonization. And physically, your body was constructed for movement. Type O blood is associated with higher baseline catecholamine activity, meaning your nervous system operates on more dopamine and norepinephrine than other blood types. When that energy has no physical outlet, it converts into restlessness, disrupted sleep, and over time, cortisol dysregulation. 30 minutes of daily walking and 2 sessions of resistance training per week will accomplish more for your long-term metabolic health than any supplement regimen. Type O. Cardiovascular strength is your inheritance. Your stomach is your responsibility. Do not allow the first to make you complacent about the second. Before Dr. Bennett continues, share your name and where you are watching from. Dr. Bennett reads every comment and would love to know who is being helped today. Type A. Type A and Dr. Bennett wants you to lean in here because this is the blood type where the gap between what people know and what they ought to know is the widest. Type A emerged as human populations transitioned toward agricultural living. Denser settlements, more intricate social environments, exposure to a broader range of infectious agents. The immune system adapted. Type A individuals mount aggressive and effective immune responses, particularly against viral pathogens. In younger years, that is a genuine biological asset. But this is where the blood type narrative becomes complicated. Because what protects you in your 30s and 40s begins working against you in different ways by your 60s. Type A blood carries elevated coagulation activity. The platelets are stickier. The clotting proteins are more active. The landmark Harvard study tracking 89,500 adults over 20 years found that type A individuals carry a 5% elevated risk of coronary heart disease compared to type O. That figure sounds modest in isolation, but here is what makes it clinically significant for type A specifically. When you layer chronically elevated cortisol on top of that stickier platelet activity, The compounding effect over decades is what transforms a 5% statistical difference into a genuine cardiovascular event. The risk is not merely in the number, it is in what your stress biology does to that number every single day. Now, here is the dimension that most discussions omit entirely. The reason that risk is so significant is not purely mechanical, it is hormonal. Type A individuals maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone, and in brief bursts, it is beneficial. It sharpens focus, mobilizes glucose, prepares the body to handle a challenge. But when cortisol runs chronically elevated week after week, month after month, it does something very specific to your arterial health. It inflames and stiffens the endothelium, the delicate inner lining of your blood vessels. And here is the mechanism that should concern every type A man or woman watching this. When your endothelium is inflamed and less elastic, it becomes a surface that sticky platelets preferentially adhere to. The elevated coagulation activity of type A blood and the chronic cortisol-driven endothelial inflammation of type A physiology are not two separate risk factors. They are a compounding cycle. Each one renders the other more hazardous. What this means practically is that for type A individuals, stress management is not a wellness preference. It is direct cardiovascular medicine. It belongs in the same category as blood pressure medication and cholesterol management because physiologically it is addressing the same underlying pathway. If you are type A and over 55, your blood pressure readings every 6 months rather than annually are not overcautious. They are appropriate clinical monitoring for your specific biology. Ask your doctor to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when elevated, actively damages arterial walls. Type A individuals trend toward higher homocysteine levels, and the intervention is remarkably straightforward. Adequate folate, B12, and B6 found in dark leafy greens, eggs, legumes, and lean proteins. This is not expensive or complicated, but it is specific to you. And establish a daily cortisol reset practice. Not a weekend retreat, not an occasional meditation session, something you perform every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds inhaling and 6 seconds exhaling, practiced for 10 minutes consistently, has measurable effects on cortisol regulation in clinical studies. The consistency matters far more than the duration. 5 minutes every morning outperforms an hour on Sunday by a considerable margin. Type A, powerful immune resilience. Elevated cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated. Managing that hormone is the most significant health decision you will make this decade. If you are still here with Dr. Bennett and finding this valuable, take a moment to type A in the comments. It lets Dr. Bennett know you are engaged and receiving value from this. Type B, the blood type that conventional medicine comprehends the least and mainstream wellness culture handles the worst. Type B emerged among nomadic populations traversing the vast interior of Central Asia and the Himalayas. These were people perpetually adapting to new food environments, new climates, new infectious pressures. The immune system that developed is genuinely remarkable in its metabolic flexibility. Type B individuals can efficiently process a wide variety of proteins, fats, and carbohydrates without the inflammatory friction that other blood types sometimes produce in response to dietary variation. That adaptability is genuine, and in the context of how we evolved, it represented a profound advantage. But here is the clinical problem that most type B individuals over 55 are carrying around unknowingly. Type B carries a distinct and not yet fully understood immune signaling profile. What the research does consistently demonstrate is that type B individuals appear to have a broadly adaptive immune response. one that processes a wide variety of dietary and environmental inputs differently than other blood types. Studies confirm that type B individuals have a measurably different gut microbiome composition, and that certain inflammatory dietary triggers, refined seed oils, ultra-processed foods, high fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B compared to other blood types. The autoimmune picture across blood types is still being actively investigated, and the findings are intricate. What is evident is that keeping your inflammatory baseline low through diet, movement, and regular CRP monitoring is the most evidence-backed protocol for type B longevity. If you are type B and have been managing these kinds of symptoms with lifestyle adjustments alone, dismissing them as simply aging, it is worth a direct conversation with your physician about autoimmune screening. Early detection of autoimmune conditions dramatically alters the treatment trajectory. There is a second issue specific to modern life for type B individuals. The modern food supply is effectively a calibration problem for your immune system. Refined seed oils, ultra-processed foods, high fructose corn syrup, these do not merely represent empty nutrition. For type B individuals, research indicates these inputs as particularly potent triggers of systemic low-grade inflammation, the kind that operates below the surface for years and progressively distorts immune precision. Your C-reactive protein level, a standard inflammatory marker available on a routine blood panel, should be monitored at least annually. A consistent CRP reading above 1 milligram per liter without an obvious acute infection is a meaningful signal. It indicates your immune system is operating in a chronically activated state, and you need to identify the trigger before it identifies you. For exercise, type B physiology responds optimally to sustained moderate intensity movement rather than repeated high-intensity bursts. Cycling, swimming, hiking, and consistent walking protect your inflammatory baseline far more effectively than interval training regimens that generate sharp spikes in inflammatory markers during recovery. Type B, the most metabolically adaptable blood type on the planet. Keep your immune system precisely calibrated, and it is one of your greatest assets. Allow it to operate unchecked, and it becomes one of your most serious vulnerabilities. Before Dr. Bennett moves on to the next section, if this is helping you connect the dots about how your body might be responding to what you consume and how you live, do Dr. Bennett a small favor and hit the like button. It helps this kind of practical, research-based information reach more individuals who are quietly dealing with fatigue, inflammation, or health issues they cannot fully explain. And share in the comments, have you ever been informed you might have an autoimmune issue, or has it always been attributed to normal aging? Dr. Bennett reads every comment and is genuinely curious how frequently this gets overlooked. Type AB. Type AB is the most recently emerged blood type in human history. It appeared relatively recently in evolutionary time when populations carrying type A and type B antigens began mixing at scale. And because of that dual inheritance, it carries a genuinely unusual immunological profile. On one side, type AB inherited the immune tolerance tendencies of both parent types. AB individuals demonstrate lower inflammatory responses to certain environmental antigens, which translates into meaningfully reduced risk of some gastrointestinal cancers and certain gastric pathologies compared to other blood types. But here is where Dr. Bennett needs you to pay close attention. Because what type AB acquired in immune tolerance, it carries a cost in neurological vulnerability that the research has made increasingly difficult to dismiss. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O individuals. The mechanism is cerebrovascular. Type AB blood carries elevated coagulation factors inherited from its A component, combined with the cardiovascular complexity of the AB antigen profile. Over decades, this produces subtle but cumulative alterations in blood flow through the brain's smallest capillaries, the microvessels that serve the regions most responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages. They are microscopic, gradual modifications in perfusion efficiency across neural tissue that most individuals would never detect until the cumulative effect has been accumulating for 15 or 20 years. This is the reason that for type AB individuals, cardiovascular health and brain health are not two separate conversations. They are identical. Blood pressure control, blood glucose management, cholesterol and triglyceride monitoring, every intervention that safeguards your arterial health is simultaneously protecting your cognitive longevity. DHA, the long-chain omega-3 fatty acid found in fatty fish like salmon, sardines, and mackerel, is incorporated directly into the cell membranes of neurons. It maintains membrane fluidity and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week, or a high-quality fish oil supplement discussed with your doctor, is not optional supplementation for type AB individuals. It is targeted neuroprotection grounded in your specific biology. Sleep is the other non-negotiable. During deep sleep, your brain's glymphatic system, its internal waste clearance network, flushes out accumulated metabolic byproducts, including the amyloid proteins associated with neurodegeneration. Consistently sleeping under 6 hours meaningfully impairs this process. For type AB individuals, chronic sleep deprivation is not merely fatigue. It is accelerating the very biological process your blood type already renders you more susceptible to. 7 to 8 hours every night. This is your most powerful daily intervention. Type AB, impressive immune tolerance. A brain that demands deliberate, consistent, long-term defense beginning now, not at 70. If you are still with Dr. Bennett and this is resonating so far, simply type "it helped" in the comments. Dr. Bennett genuinely reads them, and it helps understand what is connecting with you. The RH factor. Before we conclude, there is one more variable that almost nobody incorporates into these conversations, and it matters. That plus or minus at the end of your blood type designation, RH positive or RH negative. Roughly 85% of people are RH positive, meaning they carry the RH antigen on the surface of their red blood cells. The remaining 15% are RH negative, and this distinction is not cosmetically minor. RH negative individuals appear to carry a modestly different cytokine signaling profile, meaning the chemical language your immune system uses to communicate is calibrated differently. Research is still establishing the full clinical significance of this. But what is emerging suggests that RH negative individuals may have heightened sensitivity to certain inflammatory triggers, which means regardless of your primary blood type letter, if you are Rh negative and manage any chronic inflammatory condition, the anti-inflammatory protocols Dr. Bennett has outlined today are even more pertinent and should be implemented more rigorously. For women who are Rh negative, if you are pregnant or planning to become pregnant and your partner or baby may be Rh positive, this is a medically critical conversation to have with your obstetrician immediately. Rh incompatibility during pregnancy is manageable with appropriate medical intervention. It necessitates that intervention, and it requires it proactively. Know your complete blood type, the letter and the sign. Ensure your physician has both on record. Now, here is the most significant thing Dr. Bennett is going to convey today, and it is the thing that most blood type content completely avoids. The statistics are genuine. The risk elevations are documented. The biological mechanisms are genuinely significant, and they are not your destiny. Dr. Bennett has observed type AB patients in their mid-70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was somehow different, because they understood what their biology was working against, and they constructed their daily lives around addressing it. They slept 8 hours. They consumed 2 servings of fatty fish every week. They maintained their blood pressure below 120/80s consistently, not merely when they remembered. They kept engaging with genuinely new and challenging material, not casual scrolling, but real cognitive engagement. Their risk was still present. The statistical profile still applied to them. They simply chose to confront it directly rather than allow it to accumulate quietly in the background. The gap between genetic predisposition and actual health outcome is not insignificant. It is enormous, and it is filled entirely by choices made consistently over years. That gap is where your decisions reside. Your blood type is not a sentence, it is a map, and a map is only valuable if you are willing to examine it. Now, share something with Dr. Bennett. What is your blood type? And does the profile described today align with what you have actually been experiencing in your own health over the past few years? Drop it in the comments. Dr. Bennett reads every single one, and what emerges consistently in this community shapes the topics covered next. If you found this valuable, there is another video linked in the description where Dr. Bennett walks through the 3 most commonly overlooked root causes of persistent fatigue and elevated blood pressure in men and women over 55, conditions that are addressable when detected early and almost always mismanaged when they are not. Take excellent care of yourself. You have carried this body a long time. It is worth understanding precisely how it functions.